KwaZulu-Natal government says the province has officially entered the fourth wave of COVID-19 infections. It comes as new daily cases and hospitalizations increase, while Gauteng remains the epicenter of the latest outbreak. For more, we're joined by Progressive Health Forum Convener, Dr. Aslam Dasoo. Dr. Dasoo, good to have you with us once again. You know, I've been looking at the numbers for COVID-19 as it stands now. The Gauteng province is leading the pack at 71%, followed by the Western Cape and KwaZulu-Natal, but they're both sitting at 6%. What accounts for this huge gap in the percentage points?
Good evening, Tommy. I think the first thing to understand is that we're really at the beginning of the wave. So no firm conclusions can be drawn on either the incidence, the severity, or even the transmissibility of this new variant, even though we are seeing preliminary evidence that it transmits very, very efficiently. And I think this is a break in pattern from the previous waves, but it is just one of the manifestations of the broader pandemic. And, you know, we have been now in this pandemic for 2 years, and the experience has, you know, fundamentally altered both society, and there has been a great deal of knowledge that has informed the science on an ongoing basis. The only consistent thing throughout the pandemic, of course, has been the virus and all of its various iterations in terms of these variants. And we have this one now. You know, the numbers are going up very fast, and it usually starts with a focus area, and Gauteng seems to be the epicenter at this point. But one can be certain that the virus is now very widespread throughout the country, and cases are rising everywhere. But that's not a reason for panic, because we've learned over these last 2 years there is a fairly predictable pattern of spread, even though it may differ in degree. But it is time that we adjusted our responses, because those have remained unchanged from the start.
You mentioned there, Dr. Dasoo, that it's still very early days. Information is still being sought about Omicron. But what so far have been the key differentiators between this wave, which is starting now, and the previous 3 waves that we have had?
Well, each wave has been distinct, but this one stands out, I think, for its rapid onset. That's the one thing. The great degree of transmission, also the demographic shift in terms of the age groups that are affected. We see it affecting a younger cohort, and that's not surprising given that, you know, we saw these huge clusters in our tertiary institutions, and, you know, it's just typical of wave patterns. We've also had a fairly highly active event very recently, the elections, and, you know, just about 2 weeks after that we saw the uptick. So all of these factors, I think, have contributed to this, to the fairly unique nature of this. What I think is important is that there is still a lot of work to be done on determining whether this wave or this variant will result in more severe disease. And you know, it's very unlikely in those who are vaccinated. Those who are not are tending to become much more ill, and this is the similar pattern with the other variants.
There's a report in the South African Medical Research Council journal that speaks of hospitalizations for this particular wave that we're in now. We are starting to see a rise in the number of hospitalizations, but it's nothing really compared to where we come from when it comes to the third wave. But they noted something a bit different about the treatment of the patients who are in there for COVID-19, while beforehand oxygenation seemed almost mandatory. A lot of the patients would find themselves needing to be oxygenated, but this doesn't seem to be the case now. Can you comment on that?
Yes, I think this is about the pattern of onset. So it's been very rapid, and also it's about the higher degree of screening at our facilities. So a large number of these so-called COVID-positive cases have been found incidentally on screening in patients who came to hospital for other reasons. And this is also seen in the pediatric context. So I don't think much can be drawn from that particular issue at the moment. I do acknowledge that there has been a lag in the amount of hospitalization versus the case numbers when you compare it on a comparative basis to before. But again, this is all about the dynamics of the transmission, where it's spreading. And if it's spreading, say, in a younger cohort, that cohort is unlikely to fall as ill as older people. We know this. So I think two things have to be taken into account. One is that the correct decision was announced by the president last week not to impose further restrictions, because that would not stop the spread of this bug anyway, as we are seeing around the world. And second is vaccination, but not just maximizing all the vaccination. Of course, that is what we must do. However, there needs to be targeted vaccination of the high-risk group, because they tend to overwhelm health services. They tend to get more sick, and a large number of them are still unvaccinated. So we have to get to them. I think we've come on this journey now, and I think it's time that we begin to formulate probably new approaches to how we manage ourselves and society as we make our way through this pandemic. Eventually, we will exit it at a point where we can resume some kind of normal life, but it won't be what it was pre-pandemic. Nevertheless, we must agree right now, I think, as a society, because we are all affected in the same way, to act as one as a society. So both in the management of transmission, and here I can't stress enough that, restrictions don't work, travel bans don't work, but personal protection through masking works, prohibition of large non-essential indoor gatherings, which obviously will cause spread. So let's try and avoid that. But other than that, I think there's no call for further restrictions. All effort should now go into vaccination. Everyone should get the shot, because the protection it confers is indisputable, and it has a real-world impact on our systems, on our economy, and so on. So, we can't emphasize that more.
Can we look at a bit of a comparative study here, Dr. Dasoo? We're looking at a number of 16,366 reported COVID-19 cases and 21 deaths. Comparatively speaking, with the other variants that we've experienced and the previous waves that we've had, how comparable is the death rate with this particular strain?
I think on a time comparator, it's obviously lower than what we saw at a similar time of transmission in the other waves. So this is a fact. And this may be a function of the demographic it's infecting. A large proportion of those people have already probably been exposed to the virus. We know up to 70% of the population has had exposure, so some level of natural immunity is kicking in. And, vaccination, although desperately low in terms of the rates, is ticking up. So not particularly concerned, because also with the sharp uptick in cases and the lag that comes with hospitalization and severe disease, which is about 10 days to 2 weeks, is still being run through. So we may see, and there are reports of increasing hospitalization everywhere in the country, particularly in Gauteng, and we might just get to a point where we could now have almost a direct comparison of effect as with the previous waves. But again, it's early. I think we know how to deal with this virus. We've all learned. And there's some very basic rules that we should all follow. Until we know more, and one can be cautiously optimistic that it won't be a wave worse than the third, because that's what most of the experts believe. And if we are fortunate, it may even be less severe. But you have to recall that we had over 100,000 deaths in the last wave. And even if we reduce the number of deaths by 20%, 40%, 60,000 deaths is still a very serious thing. And so we have to approach this as though we are in the grip of the pandemic and that it is doing its worst. This may not be the last variant, as well. We may get more in the future, and we need to just be ready and adept at responding to these.
Dr. Aslam Dasoo, thank you once again for your time and insight into this. As you said, we have to adapt as we go along every single step of the way. This may not be the last variant. Chances are it won't be, from what we've observed, from how COVID-19 spreads and how it mutates. Thank you very much for your time. That's Dr. Aslam Dasoo there from the Progressive Health Forum.